Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Have you ever been walking through the pharmacy, seen that huge supplement aisle, and wondered if there's just something you can grab off the shelf for a low mood? It's a really tempting thought, right? But when it comes to actual antidepressants, the reality is way more complicated. So today, we're going to separate fact from fiction and figure out what's really available and, more importantly, why.
It's the big question, the one a lot of us have probably typed into a search engine. I mean, especially when you're thinking about the hassle of making appointments or you just want some privacy. So, can you actually just walk into a store and buy something that will help? And the answer, at least in the United States, is a very clear and simple no. All clinical antidepressants, the ones you hear about like SSRIs or SNRIs, they all require a prescription from a licensed healthcare provider. And there are some seriously important reasons for that.
Okay, so let's get into the why. This whole prescription thing isn't just about red tape or making your life difficult. It's a fundamental safety measure. The entire system is built to protect you, and it all really starts with one key gatekeeper. And that gatekeeper is the FDA, the Food and Drug Administration. You can kind of think of them as the bouncers at the club of medicine. Their job is to make absolutely sure that any medication has been put through the ringer, tested for safety and effectiveness, long before it gets anywhere near you. And for antidepressants, their reasoning is super specific. Here's the bottom line. We're talking about powerful medications that actually alter your brain chemistry. That's a big deal. They can come with significant side effects, and they can interact in really dangerous ways with other drugs you might be taking. That's why having a doctor's oversight is so crucial, not just to watch for problems, but to dial in the exact right dose that works for you. It is definitely not a one-size-fits-all situation. So, if prescriptions are so important for safety, why are so many people looking for over-the-counter options anyway? Well, the reasons are completely understandable, and honestly, they point to some much bigger issues in our healthcare system. Access is a huge one. The cost of care, just trying to find a doctor who's available, and then facing those super long wait times for an appointment, it can feel impossible. And then you layer on the stigma that unfortunately is still very real around mental health. It all leads people to search for solutions that feel more convenient and private. It's like a perfect storm of factors pushing people toward that supplement aisle. And that search almost always leads to the world of supplements. But let's get real for a second. How do these so-called natural options actually stack up against prescription medications that have been through all that scientific testing? I bet you've seen these names before. St. John's wort is probably the most famous one, but you've also got SAMe, omega-3s, 5-HTP. All of them are marketed for mood support. And of course, they're incredibly popular. Why? Because they're right there, easy to get, no prescription needed. This chart right here gets to the heart of the matter. On one side, you have prescription drugs, which are legally required to go through that tough FDA testing to prove they work and are safe. On the other side, you have supplements, which just aren't held to that same standard. What does that mean for you? It means there's a huge gap in the evidence, and the quality and even the amount of the active ingredient can be all over the place from bottle to bottle. And hey, don't just take my word for it. This is the conclusion from major medical and research institutions like the Mayo Clinic. Study after study finds that while, sure, some supplements might offer some mild benefits, they just don't have the strong, reliable evidence you'd need to count on them as a primary treatment for clinical depression. Now, it is worth pointing out that this whole conversation could change one day. There's a real debate happening in the medical community about whether some of the milder SSRIs could be made available over the counter, maybe for adults over 25. But for now, those big safety hurdles, like making sure people get the right diagnosis first and having professional monitoring, are still standing in the way. So knowing all of this, what's the smartest, safest way to move forward if you're looking for help? Well, it all comes down to having a clear, actionable game plan. And honestly, one of the biggest game changers in recent years has been telehealth. These online platforms are directly tackling those big barriers we talked about: the cost, the convenience, the privacy. They allow you to have a real consultation with a professional and even get a prescription right from your own home. It's a really powerful tool that's making access so much better. So let's just boil it all down to a simple 3-step plan. Number 1, and this is the most important one, always consult a healthcare provider first. Number 2,
Once you're talking with them, you can discuss all the safe, evidence-based treatments out there. And number 3, if getting to a doctor's office is a challenge, remember that modern options like telehealth can make taking that first step a whole lot easier. And this all leaves us with one final, really crucial question. We know the need for mental health care is absolutely massive, and we know what safe, effective treatment looks like. So the real challenge is bridging that gap. How do we build a system where getting the right kind of help isn't some frustrating obstacle course, but just a clear, simple, and accessible path for everyone?
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.